Stop scrolling and go to a mirror. Stick out your tongue. What do you see? Is it cracked? Is it puffy with teeth marks? Or is it trembling? That isn't just a random shape. It is a distress signal. Your tongue is a biological map, and today we are going to learn how to read it. It is the most visible internal organ in the human body. We use it to taste our food, to articulate our thoughts, and to swallow every drop of water we drink. Yet, incredibly, most of us never truly look at it. For thousands of years, before the invention of blood tests or sophisticated imaging technology, healers across the globe, from ancient Greece to imperial China, relied on the tongue as a primary diagnostic map. They understood something that modern science has now confirmed. The tongue is highly vascular, constantly regenerating, and directly innervated by major cranial nerves. It is incredibly sensitive to shifts in hydration, nutritional status, hormonal balance, and systemic inflammation. Today, we are going to use that ancient map. We are going to bypass the guesswork and look directly at the evidence your body is providing. We will examine the shapes, textures, and structures that reveal what is happening deep inside your liver, your gut, and your nervous system. Prepare to look in the mirror differently. This is what your tongue shape is saying about your health. Before we identify pathology, we must establish the standard. The image currently on your screen is what clinicians consider a balanced or healthy tongue. Notice the symmetry. The left side mirrors the right without deviation. Observe the shape of the tip. It is a gentle, rounded curve, neither too pointed nor too square. Crucially, look at the proportions. It fits comfortably within the lower jaw without seeming cramped or overly small. The texture is moist, indicating proper hydration, and you can see a thin, healthy coating on the surface. This shape signifies that the digestive system is absorbing nutrients efficiently, and that blood circulation is moving smoothly without obstruction. However, very few adults maintain this perfect baseline. Let us begin examining the deviations, starting with one of the most common signs of systemic stress. Examine the edges of the tongue shown here. You will notice distinct wavy indentations running along both sides. In medical terminology, this is known as a crenated tongue, but it is commonly referred to as a scalloped tongue. Those ripples are not inherent structures of the tongue anatomy. They are pressure marks. What you are seeing is evidence of a tongue that has become swollen. Because it has enlarged due to fluid retention or inflammation, it no longer fits comfortably within the dental arch. It presses chronically against the teeth. And over time, the teeth leave these distinct imprints on the muscle tissue. When we see this visual evidence, we must investigate three primary underlying causes. First, and most commonly in Western medicine, this is a red flag for hypothyroidism, an underactive thyroid. When thyroid hormones are low, the body's metabolism slows down, leading to a specific type of mucopolysaccharide accumulation and fluid retention, visible here in the tongue's tissues. Second, we look for sleep apnea. A large, swollen tongue like this is highly correlated with airway obstruction at night. The struggle to breathe creates negative pressure in the mouth, further sucking the tongue against the teeth during sleep. Third, this shape indicates issues with fluid metabolism and nutrient absorption, what traditional Chinese medicine calls spleen qi deficiency and dampness. In modern terms, we often find this shape in patients with chronic digestive sluggishness or specific B vitamin deficiencies, particularly B12. Which causes glossitis and swelling. If your tongue resembles this image, your body is signaling that it is bogged down, retaining fluid, and struggling with metabolic efficiency. By stark contrast, observe the structure depicted here. This tongue appears shrunken, narrow, and lacks the robust fullness of the baseline example. This is known as an atrophic or thin tongue. While the previous example indicated excess fluid, this shape is profound visual evidence of deficiency. The body lacks the necessary resources to maintain the turgor and plumpness of the mucosal tissues. When a clinician sees this shape, the immediate concern is the quality and volume of the blood and body fluids. The most straightforward cause is chronic, severe dehydration. The tissues are simply parched. However, if hydration is adequate, we must look deeper. This shape is a hallmark sign of iron deficiency anemia. Without sufficient hemoglobin to transport oxygen, the tongue muscles literally begin to waste away, resulting in this withered appearance. In postmenopausal women, we frequently see this thinning occur alongside dropping estrogen levels. which affects the mucosal lining of the entire oral cavity, often leading to dryness and sensitivity. In the framework of traditional Chinese medicine, this image represents blood deficiency, or yin deficiency. The cooling, nourishing fluids of the body are depleted, causing the tongue to shrivel like a plant without water. This shape is often accompanied by symptoms like dry skin, insomnia, and anxiety. The image on your screen shows a condition known medically as a fissured tongue. You are looking at deep grooves or canyons running across the surface of the muscle. It is important to note that for some individuals, this is simply genetic texture, much like fingerprints, which may deepen slightly with age. However, when these cracks are deep, inflamed, or appear suddenly, they are diagnostic indicators. Analyze the pattern of the cracks. If you see a single, deep groove running down the very center, stopping just before the tip, naturopathic doctors and many chiropractors associate this with the digestive tract and spinal alignment. A deep central fissure often correlates with chronic stomach issues, severe reflux, or ongoing digestive strain. If the cracks are scattered randomly across the entire surface, resembling a road map, we must consider systemic inflammation and autoimmune conditions. Conditions such as psoriasis and Sjogren's syndrome frequently manifest with this type of fissured, dry appearance. Furthermore, like the swollen tongue, these cracks point towards significant vitamin deficiencies. A lack of folate, iron, or B12 weakens the mucosal lining, causing it to easily separate and crack. The immediate health risk visible here is bacterial haven. These fissures trap food debris and bacteria, leading to chronic halitosis and potential secondary fungal infections. Examine the shape of the tip in this photograph. Instead of a gentle curve, the tongue tapers aggressively into a sharp, rigid point. You are looking at the physical manifestation of chronic sympathetic nervous system activation, the fight or flight response. Just as you unconsciously tense your shoulders or clench your jaw when under pressure, the muscles of the tongue also contract. Chronic emotional stress, anxiety, and high-pressure environments cause the tongue muscles to become rigid and tight, pulling the shape into this distinct point. If you observe that the pointed tip is also significantly redder than the rest of the tongue body, as seen in some variations of this shape, it indicates what traditional Chinese medicine refers to as heart fire. This is the visual signature of emotional overstimulation. Patients presenting with this tongue shape rarely need digestive aids. They almost always require interventions for nervous system regulation. They are often suffering from racing thoughts, insomnia, palpitations, and irritability. The visual evidence here shows a body unable to relax. The shape presented here is distinct from the scallop tongue, though it may look similar at first glance. Look closely at the front edge. It is square or indented in the very center, forming a W or heart shape. This is frequently evidence of a structural tether known as ankylosing, or a tongue tie. If you look underneath a tongue with this shape, you will often find a short, thick, or tight band of tissue tethering the tongue tip to the floor of the mouth. When the person attempts to extend the tongue, the tether pulls the center backward, while the sides continue forward, creating this indentation. While this is a congenital structural issue, its impact on health is significant. This shape is visual proof of restricted movement. A tongue that cannot elevate properly to rest on the roof of the mouth can lead to mouth breathing, sleep apnea, jaw pain, and even forward head posture as the body compensates for the restricted airway. It is a mechanical issue with systemic consequences. We must now move from static shape to dynamic movement. Watch the video clip closely. In the first example, notice how the tongue consistently veers to one side upon extension despite the patient's effort to push it straight. This is not a quirk, it is a neurological sign. It indicates an issue with the hypoglossal nerve, the cranial nerve that controls tongue muscles. If this deviation appears suddenly, alongside slurred speech or facial drooping, it is the hallmark visual evidence of an acute stroke, requiring immediate emergency care. If it is a chronic, long-standing deviation, it suggests an underlying neurological imbalance or previous injury. Now, observe the second example. The tongue is straight, but it cannot remain still. It trembles and quivers rapidly. This tremor is physical proof of a nervous system that is exhausted or overly sensitized. We see this frequently in patients with extreme adrenal fatigue, chronic high-level anxiety, or hyperthyroidism, where the body's engines are revving too fast. The battery is running low, and the motor control is failing. The variations we have discussed so far often relate to chronic lifestyle factors. However, the images currently on screen require immediate professional medical attention. Look at image A and B. These show localized growths or thick white patches known as leukoplakia that cannot be scraped off. The tongue is one of the most common sites for oral cancer. Any persistent lump, sore that does not heal within 2 weeks, or unexplained patch affecting the shape or surface texture of the tongue must be biopsied by a dentist or doctor. Do not ignore visual evidence of cellular changes. Look at image C. This tongue is bright, beefy red, shiny, and completely smooth, having lost all its natural texture. This is not a healthy red. This is the visual signal of advanced, severe nutritional deficiency, most commonly pernicious anemia or pellagra. It is a nutritional emergency, indicating that the body's cellular regeneration processes are failing. You have now seen the evidence. You have looked at the maps that our bodies draw for us. It can be unsettling to recognize your own tongue shape in some of those images of pathology. Perhaps you recognized the scalloped edges of digestive strain, or the pointed tip of chronic stress. But the most important thing to understand about the tongue is that it is highly regenerative. It is not a permanent sculpture. It is a living readout. Because the cells of the tongue turn over rapidly, its appearance can change in as little as 2 weeks if the underlying cause is addressed. If you saw the signs of dehydration or dryness, the protocol is clear. Increase water and electrolyte intake. If you identified the scalloped tongue, your focus must turn to gut health and thyroid function. Warming, easily digestible foods, and reducing inflammatory sugars are your first steps. If you saw cracks or strange textures, discuss comprehensive B vitamin supplementation with your healthcare provider. And if you saw the pointed tongue of stress, understand that your body is visibly begging for downtime. Breathwork, sleep hygiene, and vagus nerve stimulation are not luxuries for you. They are medical necessities. Make it a practice. Every morning, before you brush your teeth, take 10 seconds. Stick out your tongue and look at the evidence. Listen to what your physiology is telling you before a whisper becomes a shout. Thank you for watching. Stay curious and be well.